Facing a health concern can bring up many questions, especially when doctors suggest tests. Understanding what to expect can make a big difference in feeling prepared and at ease. A pancreatic biopsy is a medical procedure where a small tissue sample is taken from your pancreas to check for diseases like cancer. It is the most definitive way doctors can determine the nature of any abnormal growth or mass found in your pancreas. The purpose of a pancreatic biopsy is primarily diagnostic, providing a precise diagnosis that cannot always be obtained through imaging alone. Imagine your doctor sees something unusual on an imaging scan, like a computed tomography or magnetic resonance imaging scan. These scans can show where an abnormality is, but they cannot tell definitively if it is cancerous, benign, or inflammatory. A biopsy allows pathologists to examine the cells under a microscope, identifying specific characteristics that confirm the presence of cancer, differentiate between types of tumors, or diagnose conditions such as autoimmune pancreatitis. Most pancreatic biopsies are performed using a technique called endoscopic ultrasound-guided fine needle aspiration. During this procedure, you will receive sedation, similar to a colonoscopy, to ensure you are comfortable. A thin, flexible tube with a camera and an ultrasound device at its tip is guided down your throat, through your stomach, and into the first part of your small intestine, close to your pancreas. The ultrasound creates detailed images of the pancreas, allowing the doctor to precisely target the area of concern. A very fine needle is then passed through the endoscope and into the pancreatic mass to collect tiny tissue samples. This method is highly effective because it offers direct visualization and minimal invasiveness compared to traditional surgical biopsies. Another less common method for obtaining tissue is through a percutaneous biopsy, where a needle is inserted through the skin and guided by computed tomography scan imaging. This is typically used when the mass is more accessible from the outside. For very specific cases, or during surgery for another reason, an open surgical biopsy might be performed. The tissue samples collected, known as biopsy specimens, are then sent to a pathology laboratory. Here, expert pathologists prepare the samples and analyze them, often using special stains and genetic tests to get a complete picture of the cells. The results of this analysis provide crucial information that guides your treatment plan. Understanding the steps involved in a pancreatic biopsy can empower you to feel more in control and less anxious about the process. This procedure is a vital step in confirming a diagnosis and helping your healthcare team formulate the most effective treatment strategy, ensuring you receive personalized and targeted care for your pancreatic health.